Okay, hello. Hi. Okay, hi. This is Jessica, the respiratory therapist wannabe, and I'm doing my aerosol delivery discussion, which here's what it says. It says use information from the book on Holly S, which is here, physician orders Holly S, found in content section to perform therapy. From this example, explain the medication, why it's being given, how it works on receptor sites, the side effects, the frequency can be taken, and any other useful information I like the patient to have. Video myself and submit to discussion. That's what I'm doing. So here we have our patient. This is Holly / Gabby. She's asleep in the hospital. She had a bad reaction or something. So I have my physician's orders here. Dr. Gupta has ordered albuterol 4.5 years ago on January 8th, 2013. Albuterol. Albuterol, the medicine, it is a adrenergic sympathico. I can't say that. It's really fun to try. Adrenergic sympathomimetic. Yes. What that means is albuterol mimics the effects of what happens when your brain initiates the sympathetic nervous system. Now, what is that? That is your fight or flight response. So if you are in a high stress situation where something was going to be a danger to you, your body recognized that and it would put all these different things in effect in your body. It does things like increase your heart rate and make all your muscles tense and ready to spring into action. It constricts blood vessels and gets all the blood going. It slows your bowels down because you don't need to be digesting things when you're going to, fight for your life or run. It also dilates the bronchial smooth muscle of your lungs because when you're going to, go kick some butt, your heart rate's up, you have to be able to breathe, get more oxygen to your muscles. So it does that effect. What we can do is we can use that to our advantage. We can use the albuterol to cause a sympathetic effect in your body, which will dilate the smooth muscle of the bronchioles. So when you're having trouble breathing and the resistance is high and everything's tight because they're constricted, albuterol via the sympathetic nervous system will open up the airways and help the patient breathe. So Gabby here will be receiving albuterol, like I said, meter dose inhaler, which 2 puffs, okay, QID, which is 4 times a day, and PRN. So we're giving Gabby a meter dose inhaler treatment of albuterol. It is the puff, like all the kids in the movies that make fun of with asthma. That's what they do. So I don't actually have one. So we're not going to be doing that today. However, I will explain what's going on with these orders. 2 puffs, meaning that it takes 2 inhalations to get the dose of medicine the doctor has ordered. When you're doing a meter dose inhaler and you're taking puffs, you want to wait between 30 seconds and 5 minutes. They have a great big range. I'm not sure what the correct range is. However, I would wait at least 2 minutes, maybe, in between. Just guessing, because I don't know what albuterol's. It never said. So 2 minutes, 5 minutes. Just wait in between puffs. Take a puff, hold it 10 seconds, and then wait 10 minutes between puffs. With a dose inhaler, we also want to use something called a spacer. So you have your inhaler, right? And you know how it has a little end, a little mouthpiece, What you want to do, though, is you want to add something longer. Make that travel longer from the inhaler to your mouth. Reason being is when the spray goes in, it's going to hit the back of your throat, this laryngeal, I can't talk, oropharyngeal region right here. It's going to hit the back of your throat, and it's going to stick the medicine there, which we don't want. We want the medicine to go down into your lungs, which it does that by gravity and inertia and the size of the molecules and things like that. But what you don't want is it to stick the back of your throat. When you have the spacer, it reduces the amount of deposition in the back of your throat. It gives it more of a chance to get down into your lungs. So you want to use a spacer, which once again I don't have. That's okay. It's okay. No big deal. QID, 4 times a day. Q is 4. Quad, 4. Q. ID, day. 4 times a day. PRN, that means as needed. So when Holly here is having trouble breathing, we're not going to make her wait 4 hours to get another treatment. She can have it if she needs it. Of course, we would have to be the one to administer it, but if she needed breathing treatment, if she's having an attack of asthma or whatever she's having, then we would give it to her PRN. That's what that means. Let's see, what else am I supposed to tell you about? Oh, how it works on receptor sites. kind of covered that in the beginning when I talked about the albuterol. The sympathetic nervous system has receptors all over the body, right? So heart, lungs, blood vessels, digestive system, bladder, rectum, fun things like that. They're all over the body. And the way the sympathetic nervous system works is it turns on everything at once. There's an opposite system that is very localized. Your parasympathetic. You don't have to worry about so many systemic effects when you're doing that. But with the sympathetic one, it turns on everything. So the beta receptors, the ones that you have in your lungs and your heart, there's two. The beta 2 receptors do the bronchodilation. The beta 1 turns your heart rate up. Albuterol hits them both. That's what it does. It hits all of them. It also, via the parasympathetic, the other one, system, stimulates the adrenal glands. So it's going to release adrenaline into your bloodstream. Adrenaline is essentially albuterol. So what it's going to do is it's going to go through and it's going to hit all the receptors everywhere else in your body. Alpha, beta, there's probably many, many more. So it's going to hit all the receptors and it's going to have effects on all parts of the body. That's how it works. The goal is to not have as many. And when you have a localized lung treatment, the majority of it is going to stick to the receptors in your lungs. And so the small amount that does get in your bloodstream and, deposition in your lungs, it's not going to cause you to tense up and fight or flight. It will cause effects, yes, but because it's a localized treatment into the lungs, it will not have as many systemic effects as if we were depositing albuterol directly into your bloodstream or anything like that. And let's see, frequency, told you that. Why? Education. Potty training. That'd be good education for her. Yeah. She doesn't quite get it yet. Anyway, that's really all I have for this albuterol treatment. The main thing is to understand why albuterol works and what side effects you could have, because the patient, those are things they really, really, really need to know about when you're talking to them. You might get tremors because it's going to, shake you up. Your heart rate might go up. Your respiratory rate might go up too. That's another side effect of, well, not side effect, that's an effect of the sympathetic nervous system, is an increased respiratory rate, which you don't want when you're trying to bring it down, but that's one of the side effects, so let them know. Yeah, that's basically all I have to know. Hopefully this is what she's looking for. Sorry, it's 7 minutes long, but I like to talk, I guess. And anyway, so yes, any feedback would be appreciated. Okay, thanks.